Ilya, would you please tell us what exactly is erectile dysfunction?
Hi everyone, let's go through this. Erectile dysfunction, or ED, sometimes called impotence, is when a man has difficulty getting or keeping an erection firm enough for satisfactory sexual activity.
And how common is it?
Well, studies show that more than half of men between the ages of 40 and 70 experience some degrees of ED. Occasional difficulty is usually nothing to worry about, but when it becomes an ongoing issue, it can cause stress, lower self-confidence, and even strain relationships. Sometimes it's a sign of an underlying health condition.
Please explain that what actually causes it.
Well, sexual arousal is a complex process involving your brain, hormones, nerves, muscles, and blood vessels. A problem in any one of these areas can lead to ED.
Could you name several of them?
Sure, common physical causes include heart diseases, high cholesterol, high blood pressure, diabetes, obesity, and smoking. Psychological causes include depression, anxiety, stress, relationship issues, or other mental health concerns. Very often it's a combination of both physical and psychological factors. And yes, the risk does increase with age, not just because erections may take longer to develop, but because other health issues tend to accumulate. That said, ED can affect men at any age.
What are the main symptoms? How do I know that I have ED?
The symptoms are pretty straightforward: persistent trouble getting an erection or keeping one long enough for sexual activity. That's basically it.
Okay, how do doctors diagnose it, and what should I expect at the appointment?
Look, the first step is usually seeing your family doctor or an internist. The hardest part for most men is simply bringing it up. Once you do, you'll find it's one of the most topics we discuss, and doctors are very comfortable talking about it. Diagnosis often involves just a physical exam and some questions about your medical history and symptoms. If you have chronic conditions, or if we suspect any underlying issue, we may order blood tests or refer you to a specialist like urologist.
Well, can it actually be treated? What are the options?
Absolutely, millions of men successfully treat ED every year. The most popular option is oral prescription medications like sildenafil and similar drugs that we discuss about them in the next video.
Okay, so don't miss the next video.
Yes, this works by enhancing the effects of nitric oxide, a natural chemical your body releases that relaxes the muscles in the penis. They don't cause an automatic erection. Sexual stimulation is still needed, but the medications make the response much stronger. Other effective treatments include self-injections, urethral suppositories, vacuum erection devices, or in some cases surgically placed penile implants. If stress, anxiety, depression, or relationship issues are playing a big role, we often recommend seeing a psychologist or a certified sex therapist.
And that's any final advice?
Yes, the key point is that ED can feel like a very private and uncomfortable topic to discuss with your doctor, your partner, or your friends. But please remember, you're not alone and it is very treatable. Be open and honest with your partner. Many couples navigate this together successfully.